Hello, welcome to today's video. In today's video, we will talk about the major causes of blindness. First, let me explain what blindness. Blindness is defined as the state of being blind. A blind person cannot see. In a strict sense of the word, blindness means the inability of a person to distinguish the darkness of the bright light in both eyes. Blind and the blindness of the terms have changed in our society to include a wide range of visual impairments. Blindness is often used today to describe the severe visual decline in one or both eyes with maintaining some residual vision. Visual impairment or low vision means that even with glasses, contact lenses, medicine or surgery, someone not clear. Visual impairment can range from mild to severe. Worldwide, between 300 million to 400 million people are visually impaired due to various causes. Of this group, approximately 50 million people are totally blind. About 80% of blindness occurs in people over 50 years. When is one considered legally blind? Legal blindness is not a medical term. It is defined by legislators in countries or states to limit the eligible activities as like driving, by people who are blind legally, or government preferential advantages to these people in the form of educational services or assistance financial. Under Assistance Blind Program in the Law on Social Security adopted in 1935, defined the legal United States Congress blindness as central visual acuity of 22/100ths or less in the better eye with glasses, corrective or central visual acuity over 22/100ths if there is an abnormality of the visual field in which the field device is contracted to such an extent that the greatest diameter of the field of vision subtends an angular distance, not above 20 degrees in the better eye. Blindness in one eye is never defined as legal blindness if the other eye is normal or near normal. It is estimated that over 1 million people in the United States meet the legal definition of blindness. What are the different types of blindness? 1. Color. The blindness is the inability to perceive differences in various shades of colors, especially green and red, others can distinguish. It is most often hereditary, genetic, and affects about 8% of men and less than 1% of women. People who are colorblind generally have otherwise normal vision and can work well visually. This is actually not the case. Blindness. The 2. Night blindness. Is it difficult seeing in reduced lighting situations? It can be genetic or acquired. The majority of people with night vision difficulties function well under normal lighting conditions. It is not a state of sightlessness. The 3. Snow blindness is the loss of vision after eye exposure to large amounts of ultraviolet light. Snow blindness is usually temporary and is due to swelling of the cells from the surface of the cornea. Even in the most severe cases of snow blindness, the individual is still able to see shapes and movements. What causes blindness? The many causes of blindness differ depending on the socio-economic situation of the nation in the study. In developed countries, the main causes of blindness include ocular complications of diabetes, macular degeneration, glaucoma, and traumatic injuries. In the countries of the Third World where 90% of the population lives in the world with visual impairments, the main causes are infections, cataracts, glaucoma, injuries and the inability to get glasses. In developed countries, the term blindness is not used to describe people whose vision is correctable with glasses. Infectious causes in regions of the underdeveloped world include trachoma, onchocerciasis, river blindness, and leprosy. The most infectious cause of blindness in developed countries is herpes simplex. Other causes of blindness include vitamin A deficiency, retinopathy of prematurity, blood vessel diseases involving the retina or optic nerve, including stroke, infectious diseases of the cornea or of the retina, ocular inflammatory disease, retinitis pigmentosa, primary or secondary malignant tumors of the eye, congenital abnormalities, hereditary eye diseases, and poisoning by chemical agents, toxins such as methanol. What are the risk factors of blindness? One of the main risk factors of blindness lies in a third world country without easy access to modern medical care. Other risk factors include inadequate prenatal care, premature birth, age, poor diet, do not wear safety goggles when indicated, poor hygiene, smoking, family history of blindness, the presence of various eye diseases and the availability of medical conditions, including diabetes mellitus, hypertension, cerebrovascular disease, and cardiovascular disease. What are the signs and symptoms of blindness? All persons who are blind or visually impaired have the common symptom to see the difficulty. People with visual loss levels may have very different answers to this symptom. If one is born blind, there is much less fit a blind world that there is something for people who lose their vision later in life, where there may be limited capacity to deal with this visual loss. Support systems for individuals and their psychological makeup will also change the symptom of a lack of vision. People who lose their vision suddenly, rather than over several years, may also have more difficulty adapting to their vision loss. Associated symptoms, such as discomfort in the eyes, the consciousness of the eye, foreign body sensation, and pain in the eyes or eye discharge may be present or absent in the underlying function. Because of the blindness, a blind person may have no visible signs of any abnormality in the sitting position on a chair and rest. However, when blindness is the result of an infection of the cornea, the dome in front of the eye, the normally transparent cornea can become white or gray, making it difficult to see the colored part of the eye. In blindness cataract, the normally black pupil may appear white. Depending on the degree of blindness, the person will present visual loss signs when trying to walk. Some blind people have learned to look directly at the person they are talking with, so it is not clear that they are blind. What the specialists treat blindness. Ophthalmology is the medical specialty that deals with the diagnosis and medical and surgical treatment of eye diseases. Therefore, ophthalmologists are specialists who have the knowledge and tools to diagnose the cause of blindness and provide treatment, if possible. Type of blindness. 1. Cataract. 2. Corneal opacity. 3. Glaucoma. 4. Laser treatment. 5. Iritis. Errors. 6. Refractive. 7. Trachoma. 8. Retinopathy. 9. Squint. 10. Night blindness. 11. Corneal opacity. The treatment of blindness. The recommend conjunctivitis health care. Cleaning eyes. Drops antibiotics such as chloramphenicol. Use dark glasses. Glaucoma recommend healthcare. Line medical treatment, eye drops and tablets. Surgery. Laser treatment of recommend healthcare. Corneal ulcer use of eye drops. It is dependent on the type of ulcer. Use dark glasses. Cleaning eyes. Rest eyes for mydriatic. Iritis recommend processing health care. Local steroid eye drops and ointments, cycloplegic, systemic steroids, antihypertensive medication eye. Recommended for cataract treatment of health care. Surgery IOL. Refractive errors recommend treatment of health care. Providing entertainment. Treatment fight against trachoma recommends health care. Tetracycline, erythromycin eye ointment. Recommend retinopathy treatment of health care. Treatment of complications, control of diabetes and hypertension. Recommend strabismus treatment of health care. Surgery, refractive correction. Night blindness recommends care health treatment. Treatment with vitamin A. Corneal opacity recommend treatment of health care. Surgery, keratoplasty. Please do not forget to subscribe to our channel for more tips on health, relationships, lifestyle and other useful information to make your life easier.